Thank you for the opportunity to present our work today. Biliary complications continue to be a major problem in pediatric liver transplantation despite advances in surgical techniques and accumulating experience. Due to the small size of these patients and fragility of ducts, it is absolutely critical to be conscientious in regard to surgical technique, anatomical variations, duration of cold ischemia time, quality of the arterial supply, and immunological risk. All of these factors are considered as possible etiologies of biliary complications. Biliary complications following pediatric liver transplant range from 10 to 40%. Bile duct reconstruction is usually performed via choledochoduodenostomy or choledochoduodenostomy. Choledochoduodenostomy is seldom used and there is minimal data in the literature on choledochoduodenostomy outcomes and occurrence of biliary complications within pediatric liver transplant literature. Primary outcomes for this study were bile leak, anastomotic stricture, and cholangitis. We performed a retrospective review of all consecutive pediatric liver transplant recipients from January 1st, 2017 to February 29th, 2024, all conducted at Lucile Packard Children's Hospital. All patients were less than 21 years of age at the time of surgery. Patients were excluded if they were retransplanted, were an en-bloc heart liver transplant, or if they received both a choledochoduodenostomy and a choledochoduodenostomy. With these criteria, a total of 8 patients were excluded from the study. The picture depicts a visual representation of the 3 forms of biliary reconstruction: choledochostomy or duct-to-duct anastomosis, choledochoduodenostomy or reconstruction using the jejunum, or choledochoduodenostomy in which we connect the bile duct to the duodenum. With our choledochoduodenostomy reconstruction, we place an internal stent that drains externally to a bile bag. With our choledochoduodenostomy reconstruction, we place an internal biliary stent. We performed a total of 186 pediatric liver transplants over this time period. Regarding biliary reconstruction, there were 73 that had choledochostomy, 55 with choledochoduodenostomy, and 41 with choledochoduodenostomy. Patient characteristics collectively as a whole and within each biliary reconstruction group are shown. Recipient gender was similar between all 3 groups and not statistically significant. Recipient age at the time of transplant was significantly lower for those children who underwent choledochoduodenostomy anastomosis or choledochoduodenostomy anastomosis with a median age of 1 and 0.9 years respectively, compared to 3.5 years in the duct-to-duct group. The most common indication for liver transplantation was biliary atresia, followed by metabolic liver disease, hepatoblastoma, acute liver failure, and Alagille syndrome, among others. There was a significant difference in indications for liver transplantation between groups. Patients with a history of biliary atresia most commonly had choledochoduodenostomy reconstruction, while those with metabolic liver disease, hepatoblastoma, or acute liver failure most commonly had choledochostomy reconstruction. Children received choledochoduodenostomy reconstruction most commonly for biliary atresia, Alagille syndrome, or other more rare indications, including cystic fibrosis, Abernathy malformation, sclerosing cholangitis, or giant cell hepatitis. The majority of donors were deceased brain-dead donors. However, there was significantly more living donation donors in those patients who underwent choledochoduodenostomy reconstruction. There was no difference in ABO incompatibility or cold ischemia times between groups. There was significantly less warm ischemia time in those who underwent choledochoduodenostomy reconstruction. With choledochostomy, patients rarely had an intraluminal biliary stent, while a biliary stent was placed in the majority of patients with choledochoduodenostomy and choledochoduodenostomy reaching statistical significance. Induction therapy included basiliximab, ATG with rituximab, or some other combination. There were no differences in induction therapy between all 3 reconstruction groups. With examination of incidence over time, the incidence of biliary complications was highest in the choledochostomy group, followed by choledochoduodenostomy group. The choledochoduodenostomy group had the lowest rate of biliary complications overall, reaching statistical significance. When this was separated by the type of biliary complication, including biliary stricture, cholangitis, and bile leak, we saw significant differences in the incidence of biliary stricture. Choledochoduodenostomies had the lowest incidence of biliary stricture, followed by choledochoduodenostomy and choledochostomy. Bile leak and biliary stricture were the most common biliary complications within the choledochostomy and choledochoduodenostomy groups. Overall mortality was 4.8%, and there was no statistical significance between groups. Graft loss overall was low, with a 7.5% incidence. and it was found to be slightly elevated in the choledochoduodenostomy group compared to the other two groups. However, the graft losses were more likely related to ABO incompatible transplants. If we excluded the ABO incompatible transplants, graft survival was similar in all three groups, with no statistical significance between the groups. In summary, liver transplantation remains the only effective treatment for end-stage liver disease, and the success of biliary reconstruction remains a key determinant of both good short and long-term outcomes. This study sought to compare the anastomotic complications between the different types of biliary reconstruction and pediatric liver transplant patients. Choledochoduodenostomy was associated with the lowest incidence of biliary complications overall among groups. It should be utilized as the first approach in patients who have absent, diseased, or size mismatched bile ducts. Overall, outcomes are excellent, and biliary complications did not result in increased deaths or graft loss. Thank you so much for your time.